You may ask, how am I going to take control of my pain? I've had this pain for such a long time. We're going to talk a little bit about spinal cord stimulation, and that is how many of my patients take control of their chronic neuropathic pain. So what is spinal cord stimulation? Spinal cord stimulation is a technology that allows us to trick the brain into thinking that there is no pain, or perhaps less pain. It provides a pleasant sensation to the nerves of the spine, which then allows control of pain in extremities, so in the legs and feet, even in the lower back, and if one has chronic neck and arm pain, one can actually stimulate and get complete coverage of the extremity. What I like about spinal cord stimulation is it provides instant relief, and the patient has complete control. So here at Performance Spine and Sports Medicine, I talk a lot about the test drive. This is the trial portion of the spinal cord stimulation procedure. The procedure itself is a two-staged procedure. It's one of the only surgical procedures that allows you to test it out first, and that's done here at Performance Spine and Sports Medicine. So it's performed right here in the office. The electrode leads are implanted in the epidural space of the spine. It's done under local anesthesia. You don't feel anything as we put it in. And then essentially the device is programmed to control your pain, and the test drive begins. You get to wear that device for several days, and then it's removed. And the beauty is there's no commitment. Once it's removed, it's out. And if it works for you, it can be done on a permanent basis. Here is an image of the electrodes that are implanted during the test drive. As you can see, they're very small, about the size of a cooked spaghetti noodle. I typically will implant 2 leads in the epidural space. Again, very easily done and very comfortable. This is the stimulator. This is the device that is programmed by the technician to provide that pain relief. This is worn on the side. There's a little belt that you get, and that's simply worn on the side during the test drive. For the permanent procedure, everything is implanted under the skin, and nothing is cosmetically altering. Next is the remote control. This is the patient remote control. This allows you to program the device, allows you to turn it off when you want it off, allows you to turn it on when you want it on, and up and down, changing programs. Again, the patient has complete control over the system. So I want to talk a little bit about